Hi, my name is Alfredo Hernandez. I am a lamin positive patient and also a heart transplant recipient about 10 and a half years ago. And we're doing this recording with the LMNA Cardiac Diseases Network. And I'm here with Stephen Besant. He is one of the founders of the network. And I'm also here with Dr. Michelle Khoo. Michelle Khoo is an experienced LMNA cardiac cardiologist and electrophysiologist. And we're also going to be interviewing Kimberly Cox, who's also here with us. Kimberly Cox was transplanted about 4 months ago, 3 months ago.
Mm-hmm.
And she is also, she is one of Dr. Khoo's patients. And I am also one of Dr. Khoo's patients several years ago. The purpose for this recording is to bring some education for the patients, to bring some information about my experiences in going through the LMN disease, and also to bring some hope and some information to some of the patients, and as well as some of Kimberly Cox's experiences with the LMN disease and a recent heart transplant. So I would like to first, of course, introduce Stephen Besant. And Dr. Khoo, would you like to say anything at this point?
No, I'm very excited to hear both Alfredo's and Kim's perspectives. And this is a great opportunity to share your experience.
So I will start by, first of all, I already introduced myself, but I'm going to share a little bit about my journey with this disease, which was a very long and difficult journey, but ultimately the outcomes were quite phenomenal. I'm going to, at the age of, I'm going to go ahead and share a screen here, and I'm going to start sharing some pictures. So at the age of 39, I was very healthy. I was been an athlete most of my life, and I was training for a half marathon in Colorado. I suddenly, after training, started feeling symptoms. I started feeling dizzy and started having difficulties going upstairs without feeling like I was going to pass out. I wasn't really aware what was going on because I was very healthy before this. After feeling these symptoms several times, after training during recovery, I went to see a primary care physician who diagnosed me with atrial flutter, and he wasn't sure why I had atrial flutter at my age, but he recommended I go see a cardiologist. And I did. I went to go see a cardiologist who told me that because of my atrial flutter, I should receive an ablation procedure and that I should be fine after that. And so I did receive this ablation procedure, and in May of 2009, and here's an image of me ready for my ablation procedure. After this procedure, I was under the impression that everything would be fine with me and that I could maybe train for my marathon the following year. Unfortunately, after just about a month of receiving this ablation, or 10 months, I apologize, 10 months later, I walked into the emergency room with a heart rate of 20 beats per minute. I suddenly went into complete heart block, and I went into emergency surgery for a pacemaker implant. So I did receive a pacemaker. Here's an image of me after receiving my first pacemaker. It was just a regular 2-wire, 2-lead pacemaker. And they at that point told me that, unfortunately, they don't know why I was having this atrial fibrillation and atrial flutter and heart block that I received. And so they said I should be fine with this pacemaker and that I can resume to having a normal life. But unfortunately, as many of you have seen, that these things do not quite resolve our problem. About a year and so 3 months later, I also became very sick again. I felt dizzy. At this point, I started having some of the symptoms of heart failure. I started retaining water. I went back to see the same cardiologist. It's not Dr. Khoo just yet, just another cardiologist who was baffled why I continued to get sick. So he did a heart catheterization, Here's an image of me after receiving this heart cath. And the reason for the heart catheterization was just to assess and make sure that I didn't have any blocked blood vessels or have any issues with oxygen delivery to my heart. And that was not the case. My heart was very healthy. He said my blood vessels were very clear, and he was not aware why I was continuing to have these problems and continue to progress with heart disease. So he put me on beta blockers, and he told me at this point that I should take these medications, and that he would continue to work with me to try to figure out what was going on, but that I should be better at this particular time. Yet, unfortunately, that was not the end of my journey. This was just the beginning of my journey. About a month later, I started feeling very sick again. Once again, I was retaining water regardless of these interventions. I was having the symptoms of heart failure. I began to feel extremely sick and very worried and very scared and very anxious. So at this time, I went into the emergency room, but to a different hospital. I was very concerned that the doctors I was working with were not really familiar with what was going on with me. They were baffled. They did not know what to do. So I went to a different emergency room, and I explained to them that here I am in the bed once again, after receiving an ablation and a pacemaker, very sick with heart failure symptoms. And this is the day that I did meet Dr. Michelle Khoo. She walks into my room, and I had been, like many of our patients, many of you patients, doing your own research, trying to figure out what's going on, feeling frustrated and anxious about why these physicians were not able to resolve your problem. Go ahead, doctor.
So I'm going to just make a quick comment here that this was my first meeting with Alfredo, and he was in atrial fibrillation, and his heart rates were very high. He was going at about 140 to 150 beats a minute. And at this time, when we did an echocardiogram of his heart, his ejection fraction was no longer normal, and it was only at 30 to 35%. And I walked into the room, and there I was. I met a pretty frustrated and kind of angry patient, and surrounded by his family.
Yes, and the reason why I was frustrated and angry is I had gone in such a short period of time from training for a half marathon after living an extremely active and very healthy life to now living this life of being in the hospital, in and out, and not knowing what was going on with me. So I was very fortunate to meet Dr. Khoo, because this is what changed the course of everything that I went through. She decided to do a genetic testing, and we did genetic testing. And about 3 months later, my results came in, and I was positive for a LMNA mutation. This, she explained to me why I was feeling the symptoms. Now I began to have some understanding, but at the same time, I felt very hopeful that I was finally with a cardiologist who was going to allow me to just be a patient and not just try to figure out myself what was going on. I think a lot of you patients can relate with this problem, unfortunately. So she did a catheterization, and she also did a cardioversion to stabilize me, and she made a plan to install a biventricular pacemaker while awaiting the genetic testing results. She also gave me new medication, and she stabilized me by doing these procedures. And I did go home, and 3 months later, my results came in, and after those results came in, fortunately, they came in just in time before my surgery for the BIV, which changed the direction of what kind of pacemaker I was to receive, because as we all know now and are learning, that when you are LMNA positive, you're an extremely high risk for sudden cardiac death. And sometimes it could be, unfortunately, the very first symptoms that some patients have felt and have dealt with. So I did receive biventricular pacemaker with defibrillator. And fortunately, I did receive this because just 7 months later, I went into ventricular fibrillation in the middle of the night, and my defibrillator did shock me. And if it had not been for this defibrillator, I wouldn't be able to do this interview with Kim and be present here with Stefan and Dr. Khoo. So this was not the end of my journey. This is an image of me after Dr. Khoo implanting my biventricular defibrillator, pacemaker with defibrillator. And if you notice here, most of the pacemakers are installed on the left side. Mine was installed on the right side because I am left-handed, and this was upon my request. And this was able to stabilize me quite a bit, but unfortunately, this still was not the end of my difficult journey. Soon after this, I began to feel, I will explain this image in a little bit, and Dr. Khoo will weigh in as well to help you guys understand what this means. And this is an image of my heart. But after receiving the shocks that I was receiving, I started receiving multiple shocks and having a lot of runs of ventricular tachycardia and some ventricular fibrillation, where I did receive several ICD shocks. And so she decided to bring me back in to do an EP study. That's an electrophysiological study to see what was going on within my heart. And these are images. And Dr. Khoo, would you like to explain a little bit about what you're seeing here?
Sure. So these are the images that were obtained during Alfredo's procedure. And it's an electrophysiology study where we reconstruct the inner surface of the heart. And from this, we obtain a voltage mapping of the inner surface of the heart. And healthy heart tissue has high voltage, which is represented by the purple color. And then there are different colors otherwise, the red being very low voltage, showing basically that Alfredo's inner surface of the heart shows extensive scarring. And we were able to induce Alfredo's clinical VT, ventricular tachycardia. And the red dots represent the ablations that we delivered to transact the circuit of the ventricular tachycardia. So it was not a short procedure, but it was relatively successful for making him non-inducible for that clinical ventricular tachycardia.
Thank you, Dr. Khoo. And so at this point, I began to feel better after receiving this ventricular ablation with Dr. Michelle Khoo. But unfortunately, this is disease, as we all know, is incurable, and I continued to progress. Even though I was now in good hands, I was being taken care of appropriately. I continued to progress with heart disease. I did continue to receive more ventricular tachycardic episodes several months later. Throughout a course of time, went into what's called VT storms, and also several more shocks therapies while playing racquetball, brushing my teeth, just doing mundane things, as many patients have seen as well. And so after some time of receiving these, I went back to see Dr. Michelle Khoo. And at this point, she decided that I should go to see a specialist from San Francisco, Dr. Gerstenfeld, who had done many ventricular ablations. She had done thousands, and she felt that he would be the best person to do this procedure. I now needed what's called epicardial abrasions, where they not necessarily going in through a cath, but they're going in through the lower abdomen to ablate the surface on the outer surface of my heart, where I had hundreds of abnormal circuits.
Yeah, so Alfredo received extensive ablations on the epicardial and endocardial surface at UCSF, University of California, San Francisco. And he actually experienced quite a lot of bleeding from the surface of the heart post-procedure. And he needed blood transfusions. And I always am very careful to advise my patients that, with LMN especially, or with progressive cardiomyopathy, and Alfredo is experiencing very rapid acceleration of his disease course, that if he were to receive blood transfusions, even at UCSF, he has to make sure that it is leukocyte irradiated and CMV negative, so that he does not develop antibodies to the blood that he's receiving from blood transfusion, because this has huge implications to him if he were to receive heart transplant. So for every progressive cardiomyopathy patient that I look after, I always stay close with them and guide them, so that with the eventual presumption that they may receive a blood transplant in the future, a heart transplant in the future. And heart transplant is also determined by your blood type. So if you were to receive a blood transfusion earlier and you have developed antibodies to the blood, you are more likely to reject the new heart. And your post-transplant course could be rougher compared to somebody who never received a blood transfusion, or somebody who did not develop antibodies to blood transfusion. So you minimize that chance for a reaction by receiving blood that's leukocyte irradiated and CMV negative. So Alfredo was very sharp and followed my instructions to the T. So he received the appropriate blood transfusion that he needed, but I think that also contributed to his very good clinical course currently.
Thank you, Dr. Khoo. So here's an image of me before I went to San Francisco. I'm basically just visiting with my daughter because I know that the nature of what I'm going through is quite serious, and the procedure that I did receive in San Francisco lasted 14 hours. And I just want to add that I'll go back to this image because I wanted to just add that my daughter was tested after I was positive when she was 13, and she also tested positive. And also during this time, I was bringing awareness to a lot of family members, and I just want to say that I am the youngest of 6, and all 6 of my siblings, including all 5 of my siblings, including myself, have also all unfortunately tested positive. Here's an image of me on my way to San Francisco. I had to be transported through a medical jet, just myself and some paramedics who worked with this medical jet because my situation was quite emergent. And here is an image of me after receiving this 14-hour epicardial ablation. Now, after receiving this ablation, the doctors there did tell me that they were very successful during the 14-hour procedure of ablating a lot of these abnormal circuits that were causing ventricular fibrillation and ventricular tachycardia in my heart. But unfortunately, some of the areas that needed ablating, where they were not able to ablate because they were really close to large blood vessels of my heart that supply oxygen to my heart. And if they had, I would have most likely sustained an infarct or a heart attack or a bleed, which would have caused me to possibly die. So they told me that at this point, because of this nature of the progression of my disease and the fact that they could no longer ablate these areas, I was to be put on the transplant list. So I was placed on the transplant list, and I did very well for about just under 2 years. I felt like I was resuming back to my normal life. But unfortunately, about just under 2 years later, I did start having more ventricular fibrillation, more shock therapies. And so I was rushed to the University of Colorado, where I was listed on the transplant list. And I would like to just show this image of the last time that I was shocked. As you can see here, this is an EKG image from my pacemaker that was recorded when I received this shock. My heart rate at this particular time was 193 beats per minute.
Actually, that's not shock. That's pacing.
I'm sorry, that's pacing.
Yeah,
yes.
that terminated your ventricular tachycardia.
That was pacing. Thank you. I'm glad Dr. Khoo is here. And this is why we bring her here with us. Now, I just want to continue to add that, we're doing this video to bring education and just some knowledge to all of their patients. But because of this particular episode and there was nothing more to do, I was taken to the University of Colorado. Here I am getting prepped for a right heart catheterization just to check the status of my heart, just check the pressures of my heart. The situation was bad. my pressures were very abnormal, and they said that I was progressing with heart disease and there was nothing more to do. I reached the end of the rope for any other procedure or medications or anything else that would help me at this particular time. And during my recovery after this right heart cath, I was in the recovery room, and all of my physicians there were around my bed because my monitor just continued to go off, as many of you have experienced as well, with on and off ventricular tachycardic episodes where they had to silence the monitors. But my situation was quite grave. And unfortunately, they did not have a heart for me at that particular time. And so I was probably just going to be sent home and monitored and hope that I would not have, that I would continue to be able to survive until the heart was available for me. But I was very blessed that that day before I did leave the hospital, they told me that they had a heart available for me. So,
Thank God. Hallelujah.
so that was a significant blessing. So that evening, they told me that they had a call. I had a perfect match for me. That was a miracle for me that I needed at that particular time. So my attitude is very good, and I'm very pleasant, and I'm very happy that now they have a heart for me, that my journey would hopefully soon come to a change. And so I'm happy that I'm getting ready to go to my such short notice. I contacted a lot of my family members, my brothers and sisters who flew in from San Diego and came in from Albuquerque to meet me in Denver just in the nick of time. They made it before I was taken back to receive my transplant. So there I am visiting with my siblings before I'm taken back for my transplant. There's an image of me right after my transplant. Everything went perfectly well. I was very blessed that everything went well. And here I am after being extubated, visiting with one of my aunts. And I was extubated, but I was still under anesthesia. But I was now in recovery. There I am about 27 hours later, and I'm standing up with the assistance of some of the physical therapists. It's time for me to get up because that's what they do. You have a new heart. They want to get you mobilized and want to get you moving and walking as quickly as possible. So I was very excited for that. There's my daughter coming to visit me during my transplant. So now it's time that I'm released from my liquid diet, and it's time for me to start to get some calories and get healthy and start eating again. So there I am, just eating lots of really good food and having a pie, and I'm very happy. And now I'm doing cardio rehab and I'm exercising. Trying to get back to where I was before. So I want to just bring attention to my transplant doctor, Dr. Cleveland from the University of Colorado. I was very fortunate to get him. And the reason I was able to get him is because Dr. Khoo was able to collaborate a lot of her resources and a lot of her contacts and relationships professionally to make sure that I received the best physicians, the best care. When I went to San Francisco, the top-notch surgeon to do that procedure, and now also some of the best surgeons for my transplant. So after 2 months of cardiac rehab, I'm saying goodbye to my temporary home to recover from my transplant. And at this point, it's been 10 and a half years, and I've had a remarkable recovery, and I have a very, very normal life. So I come back to Albuquerque to visit Dr. Michelle Khoo, who was very pivotal to advocating for me, getting me the right care. And this is probably a good time for me to mention one of the purposes of this interview is that it's very important for patients to be seen and be cared for by a cardiologist and electrophysiologist who is familiar with the Lammin disease when possible. So this is a journey that the network is trying to push forward with, and trying to get more providers on the providers list within their website and their network to bring this information to patients so that they can get treated by Lammin experienced cardiologists. So I just want to bring this image. This is this year, and 10.5 years after my transplant. I am now running 10Ks in the mountains again. And there I am. I finished the 10K race. I didn't win, but I'm just happy that I finished.
That's right.
And so now this is a good time for me to start to discuss and interview Kimberly Cox, who is with us today. She is, like I mentioned earlier, she's also one of Dr. Michelle Khoo's patients. And
Stop the screen sharing so that Kim can.
And I'm just going to share one more image. And there's Kim. So this image here, I actually went to go visit Kimberly Cox in Dallas, just to bring inspiration to her, because she was awaiting a transplant. And I just wanted to bring her some hope and some inspiration that you're going to be fine, as I was fine as well, if she just followed the recommended advice from Dr. Khoo and her physicians. And there we all are visiting Kimberly Cox in the hospital. So at this time, I'm going to go ahead and stop sharing this image, and I'm going to go ahead and get some discussion with Kimberly. Hi, Kimberly. How are you?
Hi. It just got me a little emotional looking at the pictures.
Well, that's okay. So tell us a little bit about, just briefly, your journey with the Lammin disease. When did you start getting sick? When did you start having symptoms? Tell us a little bit about that.
I started having symptoms in March, and my feet was swollen, and I had to go to the hospital. The hospital said that you had complete congestive heart failure. They sent me home. They said, go see a cardiologist. Went and saw a cardiologist. The cardiologist sent me to the hospital right away because they said, you in complete congestive heart failure. Went there, went up in the hospital, and then that's when I met Dr. Khoo.
Wonderful.
So that was in March 2023, right?
Yeah, no, March 23, 25, yes, this year.
2 years ago, when you first met
Yes,
me.
when I first came. Okay, yes,
Yeah.
yes.
Yes.
You're right. You're right.
And so I have learned that you had some obstacles with your insurance to get Lammin, to get your genetic testing, but
Yes,
eventually you did get genetic testing.
yes,
Thankfully, because you were with Dr. Khoo, an experienced Lammin cardiologist who knew what you needed to get testing based on your symptoms and to
Yeah.
rule out any genetic component to your disease. So once you were tested, how long did it take from the time that you were tested positive to be listed on the transplant list? And what was it like during that bridge time?
it was almost a month.
Yeah.
Almost a month?
Mhm.
Let me
Mhm.
just clarify. We couldn't get authorization to get your genetic testing done since
Mhm.
March 2023. And
Yes,
until you were listed for transplant, which was this year,
yes.
then your insurance allowed us to do genetic testing. So it was
Oh,
just before your transplant. And before that, we didn't know because your insurance did not want to approve
yes,
for genetic testing.
yes. Thank God it got approved.
But once you got to genetic testing, it came out positive for Lammin.
Yes,
You were listed on the transplant list based on your symptoms and your condition. You qualified for the list. Is that correct?
yes,
Okay.
Also, Kim's clinical course is very similar to yours, Alfredo, except that her heart failure was more aggressive, but she had a lot of ventricular tachycardias.
yes.
I see.
So I upgraded her to a biventricular defibrillator only in this year, right?
Mm-hmm.
2025. And because she started showing a lot of runs of VT in her biventricular pacemaker, I gave her a biventricular pacemaker because we didn't have any genetic testing results at that time, right?
Yeah. Right.
So I upgraded her to a biventricular defibrillator, and then she started progressing very quickly, just like you, but within this year, right?
Mhm.
And she started having more therapies. She did not get shocked until she was in the hospital.
Yes.
Because of this aggressive clinical course, we sent you to the heart failure team,
Mhm.
and you did terrible in your right heart catheterization, just like Alfredo. And so Kim was then admitted into the hospital, and they actually placed an auxiliary left ventricular assist device to help with
Mhm.
her pump function.
Mhm.
And you were in the hospital for quite a while.
Yes, for
And
37 days.
that's around the time that I came to see you as you were
Yes.
waiting for heart transplant. And
Yes.
I hear you just got your heart transplant on August 17th of this
Yeah.
year.
Yes.
And so that's wonderful. Congratulations.
Yes.
You look amazing. You look wonderful. So how have you been feeling since your transplant? How are you doing?
I'm doing great. I'm doing great. It's just adjusting, to the medications and things like that. But other than that, I'm good.
That's
I
wonderful.
am really good.
What's the difference that you feel before the transplant and after the transplant, which seems to be a common report or common experience for most LMN patients?
Could you repeat that again?
What do you feel before the transplant?
Mhm.
And then
Okay.
now, after the transplant,
Okay.
how do you?
Yes. After the transplant, it's like I had a lot of energy. I mean, a lot of energy. But before the transplant, I was like sleeping, didn't really want to do anything, wanted to lay down. I couldn't really function, do a whole lot without getting tired or can't breathe.
That's great. And so, I want to bring emphasis to the timeline of your journey versus the timeline of my difficult journey as well. It was a little bit over 2 years that I went through a journey without meeting Dr. Khoo, who took the time to genetically test me. So, unfortunately, I had received a lot of procedures that quite likely caused a lot of scarring to my heart, but you did not have to wait as long. Your journey was much shorter. Your disease progressed a lot more aggressively than mine did, but you saw what I just shared. The big difference, and I want to bring reference to, is that you started your care from the very beginning with a LMN experienced electrophysiologist and a cardiologist. Is that correct?
Yes, yes.
That's
And I
wonderful.
think, and I thank God for Dr. Khoo because she actually helped save my life. We know that God is the source, but thank God he sent the angel to me. And I
That's
thank God for Dr. Khoo. She was on it. She was on top of it. If something happened, she called me, and I just thank God for it, Dr. Khoo. Thank you, Dr. Khoo.
that's wonderful.
I'm very fortunate to be able to look after you all. Can you describe? Alfredo said he got a lot of shocks, and he just brushed over that experience. You got a shock too. Can you explain to everybody what you felt and what was your reaction?
That shock was like a horse kicked me in my chest. And I said, Jesus, the whole hospital heard me. The nurses, thank God, the nurses, my nurse, everybody who was big was in that room. And I was like, oh my God, I do not ever want this to happen again.
It's scary.
Yes, it is. It was scary. And so I called Dr. Khoo. I was like, am I going to get shocked again?
And I'm sure that many patients that will hopefully be listening to this, they can relate to that experience as well. It's a very difficult experience. to be shocked, and a very scary experience as well. So I also know not only did I come to visit you to just give you some support. I live in Albuquerque, New Mexico, but I went to Dallas to visit you as you were waiting a transplant, because I did get phone call from Dr. Khoo asking if I would do this just for you, which I did. And also, you've also been communicating with Gabriela Pacheco, who is a member of the LMNA Cardiac Diseases Network as well. And how has that been for you? What difference did that make in having a transplant patient that's been very successful after their transplant, as well as having the support from Gabriela Pacheco and the network as well?
Okay, it was just amazing, because it helped me out with so much, and just to know that you was willing to come and see me, that meant a lot. You, Dr. Khoo, that just said a lot. Gabby is amazing. She always send me text messages telling me it's going to be all right. You're good. Everything is going to work out. She went over dietary with me. If you need something, she sent me a whole list of things that I can eat. So this whole journey for me and with you all has been amazing. And I think everyone who experienced this really needs that.
That's wonderful. It's great to hear. Well, once again, you look amazing. You look wonderful. It's great to visit with you again, even though it's on video. And thank you very much for taking your time to meet with us today. And
Yes.
You're also giving back, like I gave back. You're giving
Yes.
back to patients that will hopefully be watching this, that they can also have some inspiration and also get some information and learn from our experience, and also give credit to the disease network, LMNA Cardiac Diseases Network, for bringing this to us. And so this is a good time for me to not only thank Dr. Khoo for taking her time to meet with us, but also to Steven Besant, who is the co-founder of the network. And, as he is always trying to bring education and bring support to all of the members that are getting information from this particular network and the website as well.
Yes.
Do you have any questions?
Yeah, I think that's the takeaway for today as well. I think it has to do with early testing, if possible, education, and of course the support as well. Like you mentioned, Kim, it's amazing that you got such amazing support and that it worked out so well. So I think that's the key takeaway: early testing, education, and absolutely the support as well. So if there's any LMNA patients that want to get connected, please go to lmnacardiac.org and sign up and join the virtual patient meetings, join the network, and we get you connected in the best possible way.
Okay. Thank you so much. Thank you, Dr. Khoo. Thank you, Gab. Thank you, Alfredo. I'm just so happy to be alive.
You're more than alive. You're doing great.
Yes. Thank you, Dr. Khoo.
Thank you. Okay, well, that'll be the end of this recording. And once again, thank you, Kim. And I hope you have a wonderful evening.
Thank you.
Bye-bye.
Bye.